A very good morning to one and all. Today we are moving to another topic that is impacted earwax. Let me introduce the topic. Earwax or cerumen, the other name for earwax is cerumen, is a natural protective oily substance which is produced in the outer third of the ear canal. Let me ask you one question. How many of you know that earwax is a normal thing which is present in your in your ear? Yes, it is a normal or it's a naturally protective oily substance. So the main function of the earwax, maybe you were discussed in first year. The main function is it is a naturally protective substance. Okay, it will helps to prevent the entry of foreign body into the ear, which is produced in the outer third of the ear canal, and you can see in this earwax or that gland in the outer third of the ear canal or auditory canal. Its function is to remove foreign particles such as dust from the canal. So it won't allow the dust into the ear canal. It helps to prevent the entry of dust, and also it will helps to remove the foreign particles. This is achieved by the ciliary hairs. So you can see that inside the auditory canal, small hairs will be there. So with the help of the hairs, while the hairs are moving that time, this wax will be transported and it will be drained out. So you can see the structure of the ear. So that auditory canal, you can see that yellow substance that is called wax, which is present just before the eardrum. It will helps to prevent the entry of the uh, foreign bodies, and with the help of ciliary structures. Let us see the definition. Excess collection of thick ear wax is known as impacted wax. So our topic is impacted wax. Okay, ear wax is a normal phenomenon or a natural oily substance, but impacted wax means when the ear wax is produced or collected excessively, that we can call it as excess production or collection of earwax, we can call it as impacted wax. Or if the earwax is completely obstructing the auditory canal or external ear canal, that we can call it as impacted earwax. So you can see here, this is an example for impacted ear canal. Then the causes. Earwax buildup happens when there is a formation of earwax faster than the body can remove it. This can happen with many health conditions such as bony blockage or example osteoma or extosis. Osteoma we have discussed in the last class, small bone growth, or extosis, extra bone growth. Then infectious diseases such as swimmer's ear, that we can call the external otitis or otitis externa, inflammation of the external ear. Then skin diseases such as eczema. Then autoimmune disease such as lupus. Narrowed ear canal, then either it may be congenital or due to chronic inflammation and injury. So these are the possible causes that can lead to formation of earwax or formation of impacted ear. Okay, so earwax buildup happens when there is a formation of earwax faster than the body can remove it. So in the beginning or introduction, we have seen that earwax is a natural physiologic oil which is producing in the one third of the ear canal. And if it is producing excess, or if the ear can't able to drain it properly, that condition we can call as impacted earwax. Then the pathophysiology, due to the etiological factors, we have already discussed some etiological factors, it including infection, inflammation, congenital problems, obstruction, bone growth. What is happening? Amount of cerumen secretory is decreased and increased amount of keratin. So once the cerumen amount is secreting amount is decreasing, and increase amount of keratin. Keratin is a protein which is formed inside the or form which is a content of the cerumen. When the cerumen amount is decreasing and keratin amount is increasing, that time what is happening? The cerumen to be drier and harder. The cerumen or the earwax become dry and hard. That can lead to impacted cerumen, or it will block the ear canal. So this is a symbol for the physiology for ear impacted wax. So when the wax is, how the wax is forming, when it is not secreted properly or if it is not drained out properly, then keratin will increase in the wax, and that can lead to make the wax more hard and dry, which will block the ear canal, and we can call it as impacted earwax. Let us see the symptoms. Signs and symptoms, it including diminished hearing. Diminished hearing means often sudden onset after cleaning the ear. So there is a declining or decrease reduction in the hearing loss, hearing ability. Then discomfort, complaint of pain unless the wax is pressing or on the eardrum. When touching the ear, or when the wax is pressing the eardrum, person will get more discomfort, complaining of pain. Then tinnitus, it's a ringing like sound which is hearing inside the ear. Hearing loss, earache, sense of ear fullness, something is some heaviness or something is filled in the ear. The itching in the ear, dizziness, reflex cough. This occurs due to stimulation of auricular branch of vagus nerve. So the entire head is covered with sensory nerves. So with the stimulation of the nerve, reflex cough can occur. Then we'll move to the diagnostic evaluation. That complete health history, or in the history you have to collect the health history. Then physical examination should be done manually. Also you have to do. Then with the help of otoscope you have to do the proper examination, so you can identify the amount and intensity of obstructed ear, and you can identify the exact site of obstruction. It will help for wax removal. Then another one is audiometry. Audiometry will helps to identify the percentage or the severity of hearing loss. Let us move to the management. First one is cereminolysis. Cereminolysis, when the word itself we can identify, it's a breaking down of cerumen or wax. Second one is ear irrigation by using syringes. Then third one, instrumental manipulation, that with the help of instrument, removal of wax with hook and scoop. That two articles you can see in the foundation lab. So with the help of this scoop and hook, we can remove the excess cerumen. Let us see one by one. Cereminolysis, it is usually necessary to soften wax before its removal. This process is referred to as cereminolysis and is achieved using a solution known as ceriminolytic agent, which is introduced in the ear canal. So cereminolysis is a procedure where we are softening the, or we are loosening the wax before the removal. So the hard wax, when we are removing the hard wax, there's a chance of injury in the ear canal. So in order to prevent that one, we have to, before removing, first we have to soften or loosen the ear wax. For achieving this particular loosening or softening, we are using a thing that is known as solution, that is known as ceriminolytic agent, that will be available in the medical shop. Patient should lie with the affected ear uppermost for 5 to 10 minutes after the drop have been introduced into the ear canal. Repeated digital pressure on the tragus encourages movement of the drop and wax dispersal. So here, the person should lie with the affected ear uppermost. The affected ear should be focused upper side to 5 to 10 minutes after introducing the drop. Okay, after administering the drop, the affected person should lie down with the affected ear upper side, so that the proper wax softening will happen, and this will drain out outside, okay, while moving to the opposite side. The most common home remedy for this purpose is olive oil. Other commercially available and common ceremonialities are present. So mainly in home, as a home remedy, we can use olive oil, but it is not practically proven. So don't try to use this olive oil, or don't put olive oil inside your ear. Sometimes this can lead to infections. So some of the thermolytics are dissolved wax, solivax. So these are the things which is available in the pharmacy. This will helps to soften the earwax. The next one is cerumen hook and scoop with the help of this instrument. This instrument we are using to removing the cerumen or wax. Ear irrigation. Ear irrigation to improve hearing in those with impacted wax. The lowest pressure possible should be used. It is best avoid if the eardrum is known or suspected to be perforated. There is a history of mastoid surgery or chronic middle ear disease. If patient has unilateral deafness, a history of recurrent otitis externa or tinnitus. So ear irrigation is a procedure that last year also we discussed in foreign body in ear. So with the help of ear irrigation, you can remove the wax also. But in this impacted wax condition, there are certain things to be remained before doing the ear irrigation. If you are doing ear irrigation, you have to choose a lowest pressure. Always you have to choose a or apply a lowest pressure into the ear. And something you should remain, that is, if the eardrum is known or suspected to be perforated means if there is some infection or inflammation is there in the or is there is a chance of damage or a degeneration on the eardrum, then you should not do ear irrigation, because it can lead to entering of solution or earwax into the inner ear, then in middle ear. Then there is a history of mastoid surgery or chronic middle ear disease. If they are having any history of mastoid surgery or chronic middle disease, we should not do ear irrigation. Then if the patient has unilateral deafness, if one side deafness is there, then also we should not do, because it can, after doing, it can lead to complete loss of hearing both ear. Then a history of recurrent otitis externa or tinnitus. So if they are having any recent history of inflammation of the external ear or tinnitus, then you should avoid ear irrigation. Then for ear irrigation, we are using the syringe. That is, this is the syringe we are using for ear irrigation. Then this is a procedure. Yesterday also we have seen with this particular procedure, we can remove the foreign body. This is called ear irrigation. Next, there are some education points mentioned here. Wax is a normal physiological substance which has an important role in protecting the ear canal. The ear canal is a self-cleaning system. Do not to use cotton bud, as wax is more likely to be pushed back against the eardrum and become impacted. Earwax only needs to be removed if it causes symptoms of or if a proper view of the eardrum is needed. Why I add this point, this slide? Because this is a, common mistake or a repetitive error which is happening in between in between us, okay, in between you and me, that unnecessary we are removing the or we are cleaning the ear. So from this point you can see that, or from this slide you can see that wax is a normal physiological substance. It is normally like in your body so many fluids and so many kind of membranes are there. Like wax is also a normal physiological substance. The important role of wax is to protect the ear canal. So before removing, you should always remain, the one of the main function of the wax is to protect the ear canal. If you are removing the entire wax, then ear canal will always suspect for some or risk for some infection. Then second point, ear canal is a self-cleaning system. We have studied in when we are discussed about the anatomy and physiology. There is a eustachian tube we can see that is a passage from the ear to nasopharynx. So ear is a self-cleaning system. If there is an excess wax, it can be drained out through the eustachian tube, and the environment will be balanced. So no need to use any cotton bud or any other articles, because sometimes when we are using the cotton bud, this can irritate or it can push back against the eardrum and become impacted. More obstruction can occur. Then earwax only needs to be removed, and they have mentioned that what is the indication for removing earwax: if it causes symptoms or if a proper view of eardrum is needed. If some symptoms like impacted earwax, that time only we have to go for removal of earwax. Then self-care. Regarding self-care, ear drops to soften earwax may be used as the only treatment in mild cases. There are many different preparations on the market, none with any clear clinical advantage compared to the others. Sodium bicarbonate may be effective at disintegrating earwax. A simple home remedy is olive oil warmed by pouring onto a warm spoon. Preparation containing organic solvents are particularly likely to cause irritation and inflammation of the external ear canal and should be avoided. So these are some self-care management they have mentioned, which is home remedies, but it should not be followed without any doctor's advice, because sometimes it can lead to harm to the ear. So here they have mentioned that we can use sermonolitics in mild cases. Then Some of the items are available in the market, but it should not have any clear clinical advantage. Then sodium bicarbonate is also effective, and there is a home remedy they have mentioned about olive oil, but it should be used after warming, but it should be do with the advice of a doctor, and try to avoid the organic solvent which is available in the pharmacy, because it can irritate and inflame the external canal. Then the nursing management, examine the outer ear and the ear canal, assess the level of cerumen impaction. You have to always assess how much level is there. Then patient with hearing aid should be evaluated for the presence of cerumen impaction, because cerumen can cause feedback, reduce sound intensity, or damage to the hearing aid. If the person is using some hearing aid, then you should also examine the hearing aid whether any cerumen is obstructed the hearing aid. Educate the patient not to insert anything into the ear canal, include cotton tipped applicators, hairpins, matchsticks, safety pins, toothpicks, paper clips, or fingers. So these are the organic and inorganic substance which can lead to or which can irritate the ear canal, or also the auditory passage. So try to avoid. You have to give proper education. Then older adults should be examined for impacted wax. So in older adult, as a part of their physiological changes or related to aging, there's a chance of wax collection that should be examined properly. Eardrops can be also used as a preventive measures to avoid excess cerumen accumulation. You can use eardrops with the prescription of a doctor, so that it will helps to prevent the formation of excess cerumen or accumulation. So these are the nursing management. I hope all of you understood about the topic. Today we discuss about what you mean by earwax, what is impacted earwax or impacted ear, then what are the causes, then we have seen the pathophysiology, then what are the diagnosis for the earwax, then signs and symptoms we have seen, then management, mainly home remedies also we have seen, then supportive management, symptomatic management, then we have seen some educations regarding this earwax, how to prevent the earwax, and also nursing manager. I hope all of you clear about the topic. If you have any doubt, you can ask me and go through the topic properly. Thank you. Have a nice